This week, stakeholders gathered in Kampala for the 5th Uganda Conference on Cancer and Palliative Care with the purpose of embracing uniqueness and empowering communities.
And also the role of partnerships.
Health experts, policymakers, and leaders of community organizations attended to explore innovative solutions in the fight against cancer.
With the advent of technology,
MacDonald Mwesigwa, the Executive Director, Palliative Care Association Uganda, says government should increase support for organizations that provide cancer care because community-based interventions remain vital in reaching patients where services are most needed.
Our government has progressively invested in palliative care for the last 31 years since we have been seeing this specialized facility service in our country. But the investment is still low. Let me give you an example. In Uganda, you know that for the public health system, when you are sick, it is you who comes to the hospital. When you are unwell, it is you who will move to the hospital. In many cases, for palliative care patients, especially at end of life, when somebody has been discharged from the hospital to go back home, they may not come back easily. They need an ambulance, they need to be lifted, they cannot be turned quickly. We need the investment to move our healthcare system to go to the community to meet those people who are at that level.
Human resource gaps remain one of the biggest setbacks, according to Dr. Jackson Oriem, the Executive Director of the Uganda Cancer Institute. He says that while the Uganda Cancer Institute is ramping up domestic training of skilled professionals, the shortage continues to strain the system.
We have graduated so far 28. So if in the next year we add, let me say, 14, that means the number has gone up. Before we realize it, we already have 100 of those type of people. But the gap is still there because our estimate is that for the whole of Uganda, we need that caliber of people up to about 3,000 for us to begin saying that now we have the capacity to manage cancer properly.
Government, however, insists it is committed to strengthening cancer care, with efforts to expand and equip cancer treatment centers across the country being enhanced.
And the Regional Cancer Institute, so far that we have embarked on, to decongest, that answers the other question. So we are addressing the question of decongestion. Slowly we are moving.
Meanwhile, the private sector is also stepping in. Day Biopharma, one of Uganda's fast-growing pharmaceutical manufacturers, is positioning itself as a critical partner, supplying medical products and equipment to support ongoing cancer interventions.
We are going to start manufacturing vaccines that can prevent some types of cancers. And then the other, we are going to be making what they call biological drugs. Some of these drugs are not in Africa. I'll give you an example, pembrolizumab for lung cancer, kidney cancer. Treats most of the cancers that you talk about. When you come to Africa, you will not find that drug here. Why? It's very expensive. But I just returned from the US for the first time. We went to FDA, and FDA for the first time has agreed that yes, these barriers that have been there, that have been preventing poor countries or poor nations from accessing these drugs, we are moving what they call clinical efficacy testing. Now, when they remove clinical efficacy testing from these biological drugs, it means people who have not been affording these drugs in Africa, for the first time are going to afford it.
As Uganda's cancer cases continue to rise, experts say the fight can only be won through investment where government, health workers and private partners work hand in hand to deliver both prevention and care. David Ijo, NTV.